Austin. And welcome to our final summer webinar series presentation on planning for public health, and particularly as it relates to physical activity in the state of Texas. We've got several. We're very lucky to have our guest speaker today, whose slides just came in.
Thank you.
We'll
Make
be
sure
able
you
to
put
go
the
forward.
right ones up, the NCAP, not the PAPH course ones.
Okay. Anyway, we've got several truths, I guess, we operate from and have been over the summer as we've presented this sector-based approach to physical activity planning. First is that you have to plan. You have to plan to know where you're going. You have to plan to know if you've gotten there and how well you've gotten there. Evaluate and judge how you move next. So any public health effort has to have a central planning experience around it, we believe. Interestingly, in 2008, those of you who don't know, we came out with the first plan for physical activity in the state of Texas. We called it Active Texas 2020. It was put together under the auspices of the Texas Governor's Council on Physical Fitness at the time. It actually predated the U.S. National Physical Activity Plan. Because of that, because of those efforts, we are in the midst of revising the Active Texas 2020 into an Active Texas 2030 edition to bring it more in line with the U.S. National Physical Activity Plan. Those of you who don't know, the U.S. National Physical Activity Plan takes a societal sector approach and sets strategies and evidence-based and evidence-informed strategies and tactics toward improving physical activity across 10 sectors, societal sectors, in which we all live and cross through every day. We are updating this plan, obviously, with the key theme that all health is local. What is put forth in plans at national, even at state levels, may not be relevant for people's needs, say in the Rio Grande Valley, or in the panhandle of the state, or in urban Houston or Dallas. And so we're engaging stakeholders. These webinars over the summer have been designed to engage stakeholders, get experts like we have here with Dr. Eyler to give us a presentation, and then with a question and answer session, be able to hone in on some key things that all of us may be interested in. There are 10 sectors in the National Physical Activity Plan. The military sector led us off, and it is the newest addition to the national plan. Today, we're focusing on the public health sector. What can people who work or are interested in public health do to understand better how to plan physical activity in communities? Like I said, we're extremely fortunate today to have Dr. Amy Eyler from Washington University in St. Louis join us today. In addition to all of her tasks, she's really quite busy. She also is the chair of the public health sector for the U.S. National Physical Activity Plan. And she's going to regale us today with the strategies and tactics and other pearls that can be found in the public health sector, and then allow us to answer questions and pick her brain a little bit about what's going on. So Amy, welcome. I'm going to stop sharing here a minute. I see that Dr. Russ Pate is here. Russ, are you still here, or did you go?
I'm here, Bill.
Great. While I tee up Amy's slides, would you mind saying a few words? Russ, Dr. Pate is the grandfather, really, of the National Physical Activity Plan, has been involved and has been a key driver since it began. I wanted to give him a chance to say a few words, and it's perfect because now I can get Amy's things together, Russ, while you're doing that. Thank you.
Sure. Thank you, Bill. And thanks everybody very much for being here, particularly to Amy for leading the discussion today. As Bill said, I certainly agree with the sentiment that that public health really has to come right down to the local level, and that state leadership is critical. It's true that one of the overarching strategies in the current National Physical Activity Plan calls for strengthening state planning around physical activity across the country, and Texas has been a leader in this, and continues to be a leader. So, I think what you're doing here today really is very consistent with what we hoped would happen, sort of in tandem with the development of a national plan. So, looks like the slides are queued up, and thanks again to everybody for being here and for your support of this very important process. Bill, back to you.
Great, Amy. Just I'll dish it to you, and you can lay it up or dunk it, however you want. I prefer a dunk, but go ahead.
Okay. All right. You can switch the slide. I really appreciate being here, and I really appreciate that Texas is a front runner. When we think of Texas or West Virginia, they're usually we think of the New Yorks and the Californias as rising the bar for these things. So I think it's awesome that you guys are leaders in this and can be a benchmark for these other states. So congratulations on that, and especially working on this new revised edition. So some of this stuff may seem obvious. Why public health? Why is public health a sector of the physical activity plan? The main gist of public health is promoting, protecting, and maintaining health, as well as preventing disease at a population level. And there's decades of evidence to show that physical activity promotes good health and prevents disease. So it's a perfect match. I gave another lecture this morning to a group of folks taking the physical activity and public health course, and I was talking to them about the London bus studies, and that was in 1953. So the first study that linked cardiovascular mortality with physical inactivity was in 1953. So we've known this for a really long time, and it's a great connection, and a really important, I think, a very important sector of the plan. Next slide. So the focus of the public health sector, our strategies focus on developing a competent workforce, building partnerships, developing policy and advocacy efforts, improving surveillance and evaluation, dissemination, and funding and resources. So all of these things together, they sound like what we would do for interventions or things like that. And that is a nice synergy between the physical activity plan and public health, as well as other sectors, because a lot of these cross over. If I'm the last sector giving this presentation, and you've been to several of them, you're going to hear some commonalities and places to collaborate. Next slide. So who's involved in the public health sector? A lot of different places, but mainly governmental organizations such as public health agencies at all different levels, federal, state, county, and local. And we know that different places have different capacities and different ways that their health departments are set up. They could be local, they could be regional. St. Louis, where I am, is very unique in that we have St. Louis City, which has its own health department, and St. Louis County. St. Louis City is in the county, but we have two health departments. So making sure that they have the capacity to work in the metropolitan region related to physical activity is really important. But then there's some non-governmental folks too, organizations like institutes of higher education, professional societies. You'll hear the Physical Activity Society mentioned a lot, which is part of the Alliance, nonprofit organizations, think tanks, and advocacy groups, in particular advocacy groups related to transportation, perhaps. And so you can see that linkage between the other sectors. Next slide. So what do these people do? They could do research, they perform surveillance, within communities in a whole bunch of different ways, program development and delivery, evaluation, training, again, that's that capacity issue, and advocacy. And that's just a sample of what some of the public health sector members do. Next slide. So I didn't put everything on these slides because you can go and read about it on the website, but I wanted to highlight some things that are relevant to what you are doing. So the first strategy is public health organizations should develop and maintain a workforce with competence and expertise in physical activity and health that has this capacity to learn about and implement ethnically, culturally, different ability levels and gender diverse interventions. So really tailoring it and making sure that we look at this through an equity lens and develop this competent workforce. And so one of the tactics under this strategy is promote efforts by CDC, professional societies, and academic institutions to provide training and capacity in the use, adaptation, and evaluation of evidence-based physical activity promotion strategies. So, and then we have related objectives. Again, really working with these existing entities like CDC and professional societies that already have these networks built in. We're not starting this from scratch. Working with academic institutions for example, MPH programs, and see what kind of physical activity training can be promoted through there, because they're often the pipeline to these public health agencies. Really focusing not only on the trainings, but also dissemination of them. With the internet, there are tons of things you can do out there, but really creating a place where we can have access to these different types of trainings and making sure they're updated will be an important part of this first strategy. And then the third bullet point is, again, adding that diversity in it. We want to pay attention to that we have a diverse workforce, that we can create those ethnic and culturally and different ability levels and gender diversity components when we do these types of interventions. Next slide. Another part of strategy one, another tactic, is to support the creation of a physical activity and health unit in state health departments. So this is the ultimate goal, that just like, chronic disease and all these other units that you have in health departments, have a specific one for physical activity. And it could be cross-referenced with other departments based on however the department may be set up, but really thinking about it as a coordinated approach to chronic disease prevention, because we know physical activity helps to prevent cancer and diabetes and obesity and all these other things that are often efforts of the health departments. So our goal is by 2025 to have a good proportion of states having, or at least thinking about creating, this physical activity health unit, and with the ultimate goal by having that as the norm. Next slide. So strategy two is public health agencies should create, maintain, and leverage cross-sectional partnerships and coalitions that implement evidence-based strategies to promote public health. Or, sorry, wrong lecture, to promote physical activity. And this is really important because we can't do this by ourselves. You can see why there's 10 sectors in the National Physical Activity Plan, because we have to create these cross-sectoral partnerships. I was just working on a project related to trails and working with occupational therapists and physical therapists to measure grade and hills and all these other components to make sure that it is accessible to all. And we wouldn't be able to do that. Public health in and of itself doesn't have that type of training, but really working cross-sectorally in these in partnership with the other sectors of the plan, as well as beyond that, to make sure that we can implement and create the best environment for physical activity. So one of the tactics is examine successful cross-sectoral partnerships to identify and incorporate key elements of success. So like Bill was saying, we have to plan, we also have to evaluate. So what works, what doesn't, what could we replicate, and what are the lessons learned? So by 2025, Public Health Committee will develop a cross-sectional framework to be used when planning and evaluating the physical activity initiatives. Next slide. Strategy 3, nonprofit public health organizations should engage in policy development and advocacy. There's a little footnote there for those that work in government, because sometimes that word can raise a red flag, to elevate the priority of physical activity in public health practice, policy, and research. So really working on that dissemination and policy development, overarching, creating these opportunities and access for physical activity by helping develop and implement these policies. If you have a policy in place, it not only affects the people there today, but it's going to be a sustainable approach to maintaining that, that initiative. So advocate for the creation and funding of Office of Physical Activity and Health with the National Center for Chronic Disease Prevention at CDC. So really thinking about this schedule of creating and maintaining this advocacy group and this Office of Physical Activity and Health. Again, it's unsiloed and working cross collaboratively, just like the National Physical Activity Plan does, to with the ultimate goal of increasing population physical activity. Next slide. This is also related to strategy 3, engage decision makers in funding research on policy development and evaluation of the effects of existing policies related to physical activity. And these policies could be enablers or barriers to physical activity, but really reaching key decision makers and preparing what information they might need to know to be informed about this. So by 2020, which is past, we really wanted to partner with the research organizations to develop advocacy information on evidence-based policies. And this is done a lot. It's just not aggregated into one place, but there are a lot of these out there. Policy briefs, and most often policy and makers and decision makers want to know what's the problem, what can we do about it, how much it's going to cost. So creating that information, providing evidence, providing data will help get that policy support that's needed. Next slide. Strategy 4, public health agencies should expand monitoring of policy and environmental determinants and the levels of physical activity in community through surveillance, and also really focus on that evaluation piece. So, and we're doing this, we're moving in this direction. So a tactic is to identify and promote a common set of measures that can be applied across diverse populations to track the progress of physical activity promotion in the state at national, local levels. And really coming up with core sets of questions that we can compare apples to apples to, I think is really key. And what are the best and most feasible surveillance pieces that we could do where we can start looking at trends over time and also compare across populations. So by 2025, professional societies with physical activity focus will identify common measures of physical inactivity, sedentary time, and light activity, because there's all sorts of different measures of those. And again, so we can monitor trends over time. A consistent measurement is very important. And by 2030, professional societies with the physical activity focus will implement a surveillance plan in partnership with key state, national, and local partners. So creating this system where everyone is kind of doing the same thing, because that not only helps in surveillance, but it also helps in research, because then we can compare and we can partner, you can partner with academic institutions to really create this strong support and messaging related to the change in all sorts of benefits from physical activity. Next slide. So this other tactic related to strategy 4, develop a report card that's informed by evidence and tracks actions taken and progress in reducing the burden of disease due to inactivity in the United States. And use this report card to regularly assess and report the progress. So, a report card is pretty easy to understand. We've all went to elementary school, even if it's a pass-fail. Grades are a big deal. And so we've worked on this. Russ, we worked on the walking and walkability one just a couple of years ago and gave states grades on certain things. And by 2023, we want to develop a reporting framework and template to document and report key surveillance indicators for physical activity. So we have the one that we did a couple of years ago, but using that as a template moving forward for other facets related to physical activity or inactivity. And by 25, we'll produce the physical activity report card using data at various levels where available. Again, that's why surveillance is so important, and that's why consistent surveillance is important, because they will help inform these types of report cards. Next slide. And also related to 4, expand surveillance systems to monitor the status of environmental and policy determinants. So it's not just the behavior that we're looking at, we're also looking at the environment. What are correlates in communities to physical activity, or what are barriers? What doesn't exist in communities? And then again, looking at it from that disparities or equity angle, and look at resource availability and utilization. So by 2025, we want to partner with key national, state, and local partners to develop a surveillance plan and a timeline. Again, it's easier to create this message and support if we have this data and evidence. And it's even better if we can compare across sites and create this, this system where we'll have this information and it's conducted on a regular basis. And by 2025, we want to partner with key national, state, and local partners to implement that surveillance plan. So really take the time to think about what already exists, what we could use, create the surveillance plan, and then implement that plan. Next slide. Strategy 5, public health organizations should disseminate tools and resources important to promoting physical activity, including resources that address the burden of disease due to inactivity, the implementation of evidence-based interventions, and funding opportunities for physical activity initiatives. So I think we do a pretty good job at trying things and doing research and creating these initiatives. But what we lack is, I think, really effectively disseminating what we do beyond just our target audience. So for example, academics, peer review journals, but we really need to target more policymakers and community stakeholders, other people and practitioners who might be doing the same thing, who they could learn from what we've done, and again, cross compare some of the findings. And so to do that, one of the tactics for strategy 5 is to create repositories and clearinghouses of information on public health practices, tools, and resources, including evidence-based and promising physical activity interventions in practice. And CDC does a pretty good job at this. You can look at the community guide, but I think that's there needs to be a more local level and a sort of a better way where people can upload their own things. So we could have this clearinghouse and repository where people could share and crowdsource some of these important things that are going on. So by 2025, we'll create this resource checklist. Our goal is 100 resources across all categories, like measures, tools, toolkits, policies, and put them in one place for people to use and potentially replicate. And then by 2027, state health department websites will include a link to this checklist. So there's some coordination in this as well. It's the dissemination piece where it feeds into this resource list, but then making sure that resource list gets out to others who would be most likely to need or use it. Next slide. Strategy 6, public health agencies should invest equitably in physical activity commensurate with its impact on disease prevention and health promotion. We all know, we've seen the studies on how many lives could be saved if people become more physically active, and the burden and the economic burden of physical inactivity. So, but there's this inequity in how much money is put forth for physical activity promotion and interventions in comparison to other things. So really creating resources and state and local health agencies and programs with comparable resources for things like tobacco and nutrition. And I think the key to that is really creating these messages, these compelling messages, evidence-based messages to get that support. and provide sustainable funding for state and local health departments so that physical activity and public health specialists can create and implement initiatives that promote physical activity. So that is our tactic for strategy 6. Next slide. And I think that's it. Are there any questions? That was public health sector and warp speed. Can hear you, Bill. Anyone have any questions or comments or something that you might bring from your own experience that could inform any changes that we could make to our approach?
Can you hear me now?
Yes.
Okay, I don't know what happened there. Anyway, I was just saying thank you very, very much for a great overview. It was a lot of information, and we're not in public health used to things moving that fast. So we wanted to say thanks. I want to say thanks very much. I've got several questions while people get teed up for any questions. Please post anything that you might have in the chat box, and we'll be able to get Dr. Eyler to weigh in on it directly. Amy, one of the things that we're trying to figure out for Texas is where to start, obviously. A lot of people here may be a lot of people here may work in local nonprofits or in the state health department or county health departments and the like. And where's the low-hanging fruit? This is a kind of a comprehensive guidepost, if you will, or a comprehensive set of strategies and tactics. But someone who's in a position, who may not be in a position of influence right away, where should we start to get some of the places in Texas working towards this effort?
I think a good place to start is to think about what's already available. What information is already collected that you can use to get that support for whatever policies or programs you want to do? And there's a lot out there, and every community differs in the amount of information that they have, and thinking about it broadly. So not just sidewalks or parks, but the broader social determinants of health, like housing and those kind of things, can create compelling arguments because they're all connected. And like a resource like the AARP Livability Index, I don't know if you've ever visited that before, but it is an aggregate of a bunch of different data sets. So maybe people don't want to go out and walk because of crime or safety. Well, if you go on that livability index and type in your zip code or whatever, you can get crime data, you can get walkability data, you can get all sorts of things. So I think that if you want to gain support from a broad variety of stakeholders, is look at that data, that's available, and that also can inform what else is needed and what you might need to collect yourself in order to start looking at the trends or the gaps or population differences.
Yeah, I think something you point there is building that collaboration is a theme. Certainly, we've heard in the previous sector reports in the webinar series this hour is while the plan is organized by sector, societal sector, and there are strategies and tactics. that relate to each sector. None of us live only in one sector. You said yourself you were working with working on a trails project that engaged public health. It engaged probably someone in the transportation area. It certainly engaged someone in the medical community. You said you were talking about OT and PT and so forth. So building that that collaboration seems to me to be a vital piece, no matter how we talk this through, I think.
Right. And if Bill is still on, I can't remember all the sectors. They weren't all 10 sectors that were involved in that report that we did. Russ, do you remember that? But we all got together and we were all talking about walkability. And it wasn't just public health. It was transportation. And I don't remember. Russ, can you? We all got together and we talked about the same topic, and we wrote a white paper for CDC related to that. So that was a good example of that cross
Working across sectors. Yeah, there are a couple of comments. I don't know if Russ is still here. A couple of comments in the box, and we're small enough. If if you have access to your microphone, go ahead and ask. Denon Langley, I guess, asked what kind of surveillance. Are you here, Denon? One of the things I think you emphasized in surveillance, and many people seem kind of surprised about that. You know, the literature, the research in enablers and barriers to physical activity, as you said, goes way beyond these days human behavior. Are people meeting guidelines or not? Things like that. And the importance of surveillance systems, advocating for surveillance systems, whether they're repeated surveys, whether they're one-off surveys or like, but to try to develop and gather data that local people can use about sidewalk connectivity, for example, parks prevalence. We heard from Deb in the community recreation and fitness and parks last week, where just knowing the distance, the average distance to parks, will play a big role in decision makers, policymakers, settings for upgrading and creating new parks. So these surveillance systems, I think you were talking about, go beyond getting just how many people are meeting guidelines, but trying to get a handle on what some of the environment and policy areas are that could help people get physically active. And that's something that can be done locally.
Right.
Go ahead.
And I was just involved with a National Academies project, and I was working with developing recommendations for surveillance of community supports for physical activity. So again, thinking about someone who works in an advocacy agency or a practitioner, maybe not with a research background or can't like say all the assessment tools, acronyms just off the top of their head. So we got a team of people together. We looked through all the assessments that were available, and we came up with key questions. If you're going to do this surveillance, this is what you should be asking. And those will be up on the National Alliance website very soon. And they're in very digestible formats of a research brief. So that's one example of surveillance that you could do yourself. And I put in the chat the livability index. And again, it pulls from the census, it pulls from lots of local data, and it varies by place because some places have more data, but it's kind of fun to just look around on that.
Yeah, and it does make sense for someone, for example, in Amarillo or San Angelo to use data from a state that has such diverse urban, rural, and cities and dense cities and not dense rural areas all the same. So making that as local as possible seems to me to be an important consideration. Sophia, do you have a microphone handy? Can you open and talk about, ask your question about St. Louis?
Yeah, hi, thank you so much, Dr. Cole, for the welcome, and Dr. Yeah, Euler. Sorry if I'm pronouncing that incorrectly.
Eyler.
Eyler. Thank you, Dr. Cole. So my name is Sophia. I actually live in Texas now. I'm from St. Louis. So I was interested in which aspects of the presentation of these sort of resources you have found successful to the public or policymakers of St. Louis.
So it's interesting. I think it comes in phases. First, you have to show up, show up and be present at meetings. And so getting to know those local policymakers, working in collaboration with some local agencies. So we have a great pedestrian and bike agency, TrailNet, that you might be familiar with if you're from here, and working with them that to help to make sure you're not reinventing the wheel and that the policymakers are not getting a message from this group and this group. So you're presenting them with sort of an aggregate piece of information to support your initiative. But it takes time to build that and understanding what else is going on in the context of the city. So St. Louis is pretty complicated. It's been for a long time. So really thinking about the bigger picture of what's going on and how you could still promote what you want and work it in to the goals and priorities that might be coming out of different initiatives. So for example, with COVID, and parks being open and being promoted as a place where it was safe physical activity. That was a benefit because what people complained about Forest Park and parks here was the traffic. So closing off streets and allowing people to have a safe space is great. And then so taking that information and evaluating that from a bunch of different perspectives and then taking that back to the policymakers and showing them what an impact it has. So it's certainly not a one-stop shop. It takes time and lots of collaboration and skill to create those messages. They don't really care about p-values or those kind of things that nerdy researchers do, but making that compelling researchers our message. And one more thing is to involve the community. So most of these officials are elected and they have a responsibility to their constituents. So making sure that constituency is heard in your message will only support what you're doing.
Amy, you've been very successful in St. Louis in building coalitions like that, a variety of things over the years. Is there one ingredient that has to happen every time?
Patience. I would say patience and understanding, especially in this politically divided environment right now, understanding, not necessarily agreeing with the other side, but understanding where they're coming from and understanding why they might not support what you're doing. And so listening to that message, and it may not happen overnight, but really coming together and creating a common ground, which is difficult, and you need patience and you need that relationship. You don't want to be an adversary. You want to have that supportive and collaborative relationship with these people who can support these initiatives.
Yeah. Other questions or comments, please post them in the chat. One of the things we're looking to, Amy, as I mentioned in my preamble, was make this so that it can happen locally. Whether it's a small town in West Texas, whether it's in the Rio Grande Valley, East Texas, the woods, piney woods and so forth, everybody's different. And if there is someone in the area who is maybe not, maybe just an interested party, passionate about health, passionate about physical activity, is there a first step to the coalition building that those people could take into consideration? Patience is a virtue, as I understand it. I don't really have a lot of it, but from a tangible first step, we heard from Deb Cohen the other day about really engaging decision makers, whether they are elected or appointed officials. That's kind of the political route and a top down. But from a grassroots standpoint, are there things that you've seen or things that you could share that the people who want to advance some of these things in the public health sector might be able to do?
I think the first thing is to, if it's just a person who might be interested, say they're recently retired and they want to make this their mission, but without the background, learn what else is going on. What other things in the community can you build on? Are there already existing coalitions or networks? And potentially partnering with them. If they already have a network about smoke-free kids or something like that, more than likely they're going to have parties interested in health. And so thinking about what they're doing and how you could connect with that, but also you know, sometimes there, like even in St. Louis, there was something sponsored by the football team that we no longer have related to kids' physical activity, and it just popped out of nowhere. But you know, those are the kind of things that we want to partner with and be aware of, because you want to work together as a community. So assess what's going on in your community, and then look at the data that's available and start planning for some kind of surveillance so you can create that message to get that support.
Mm-hmm. Is there some kind of an accelerant that you can wave over and sprinkle some magic dust on to make things happen faster in your experience with building these partnerships, Amy?
Well, you know, sometimes things happen just naturally, whether someone gets interested in bike lanes or something like that, some politician. But I think that is, yeah, I really, one thing is a little competition. I don't know what it's like in Texas, but there's a little competition between our neighbors in Illinois, or, you know, all our municipalities. And so if one does one thing and it works, shine the light on that. And that has worked to some extent in our area here, because it makes the place more desirable to live. You know, property values go up because these things happen. Displacement can occur, which is not not a good thing, but those kind of things. I would say, you know, one time it could patience, luck, and a little bit of competition. Sounds like sports, doesn't it?
Well, it reminds me the competition can be based on surveillance data.
Right.
And
Absolutely.
and no community leader wants to be behind,
Right.
obviously, and so the beauty of the surveillance data, which is the cornerstone for public health, really, is using it for change like that, and to jumpstart some of those things. That's a really important point, I think, that not a lot of people miss. You can get lost in p-values, but when you can show the percentage of your population that lives within a certain distance to a park, that is a powerful thing to do, rather than just say, well, we've got lots of parks around.
Right. Economic data, if you have any kind of cost benefit, that will also be a compelling message.
Yeah. I'm also curious, and again, please post questions. I don't mean to dominate here, but this is fascinating to me as well. But I'm also curious about the capacity building work within public health. Again, is there something that someone at a state health department, for example, might be able to do to help stimulate capacity building in this area? We have a program at the UT School of Public Health where people can get trained in physical activity and public health as part of an MPH degree. But on the other side, is there something that agencies or people within agencies can do to help stimulate that capacity building for this area?
Well, there's that physical activity and public health course that's coming up, put on by South Carolina. But I think that's part of the things that we want to do, Bill. I know that there's lots of trainings out there and resources out there. Putting it together in a place that can be easily accessible and be different modes, so people in the health departments can access it at their you know, whatever they're looking for, if it's a course or just a webinar or something like that. And then also connecting, well, with the Alliance or other places that might offer programs or something on physical activity. I know NACDD does some things, APHA, so connecting with those agencies to see what's available. But that's definitely one of the things that we would like to get done.
One of the 3 sections of the new U.S. Physical Activity Alliance deals with professional development and creating these kind of trainings and certificates that people who are already busy don't have to stop and take another master's course or master's degree or things like that, but can do that from online training. I think to look for that more is a great suggestion. Any other comments or questions for Dr. Eyler today? I'm not above ending early if we don't have anything additional. I've posted some links in the chat for the national plan, specifically for the Alliance, as well as going straight to the public health sector for the full list of strategies and tactics and objectives. There was an email here, an email address that comes right to me, activetexas2030@uth.tmc.edu, for anyone who wants to share some experiences, ask additional questions. Happy to do that. I promise to get right back to you. Good. Tracy, you want to open, if you can, open your mic and talk
yeah,
about.
I don't know how related this is, but I just wanted to throw that out there as another way. This organization I learned about just this week called Birdability. I went to a bird watching sort of convention, and this lady was just amazing. She's in Austin, but anyone can do this anywhere. You can go to the website, and any natural area or trails, in your city or anywhere, you can go and you can you take your tape measure with you, and you take measurements of different things and put on there. It's all objective, so anyone with any type of disability, whatever it may be, they can look at it and see if it might be a place that they might want to go and be able to be. Bird watching is a great way to be physically active. It's just another hobby to get people out there. So just wanted to throw that out there.
I didn't know about that. I like watching birds too. I'm going to go check that one out. Thanks for the tip.
Yeah, that's great. And that's this crowdsourcing that's really becoming a way to involve the community in data collection. And whether it be taking a picture and uploading it, or using photo voice or something, but allowing people to collect this data and then see the results, the collective results. That's it's becoming more and more common.
Yeah, thanks.
Thanks for the tip. Other comments? Questions?
Hi, thank you so much, Tracy, for sharing. I definitely have some knowledge on bird watching as well. I wanted to bring up, I put a link in the chat about extreme heat from a local news publication. They used, it says, electric counters to track hourly pedestrian and cyclist traffic on a popular Austin trail, looking for the connection between temperatures and trail use. So I think that was really interesting. I wanted to see maybe if in St. Louis you had found similarities between like the seasonality and activity, especially when we're thinking about outdoors or bird watching or biking or walking. So all these different things that might be difficult as heat barriers come into play with Texas.
Yes, I think we're pretty close in the temperature wise. You may be a little hotter, but we are just as humid here, and we do see that. We've had some extreme heat in the last couple weeks for sure, and then you're going to see that seasonality again in the winter when it's really cold, and that is a consideration with surveillance. So making sure that when we compare apples to apples, that we take factors like that into consideration. So we're not saying what people aren't active, but well, then looking, it was 100 degrees and 100% humidity, and that's why people weren't active during that time. But that's a really good point. It reminded me of one more thing really quick is The National Weather Service, I believe, has 13,000 webcams around the United States. The project is called AMOS, and they take a picture every 30 seconds. So 13,000 cameras, a picture every 30 seconds. And they're looking for weather patterns. But my colleague, Aaron Hipp, I don't know if you knew this study, Bill, but he looked at the cameras that were facing crosswalks and parks and sort of working with computer science to call all that information into changes and surveillance. So I think these new strategies, like you mentioned, with these heat maps and things like that, are definitely up and coming. And there's lots of creative folks out there who are collaborating with computer science folks and engineers to make our surveillance better.
Particularly with physical activity, looking at environmental changes, I think are just drastically important to be thinking, not just asking questions and asking another survey for participants to talk about infrastructure, but actually measuring those things is a terrific idea, I think. Well, I'd like to thank you all for joining. I certainly like to thank Dr. Eyler for leading the discussion, Dr. Pate, who may have had to leave, but this recording will be posted on the Michael and Susan Dell Center website shortly, along with a PowerPoint. If anyone needs to have anything clarified, that'd be great. I would like to thank the Michael and Susan Dell Center for Healthy Living and the UTL School of Public Health. The Texas State Department of Health Services, we're working with to revise this towards an Active Texas 2030 state plan. And then the Physical Activity Alliance, which this is the national organization under which the national plan have all contributed to this series. And you can find the previous webinars as well as this one shortly. I see that Amy has posted her email address directly there in St. Louis. I'm sure she'd be more than happy to answer any questions or learn about some experiences that people on the call have. Amy, thank you on behalf of everyone here and all my 30 million friends in the state of Texas. Thank you very much for spending some time with us today and teaching us a little bit about the public health sector. Have a great day, everyone.
Bye. Thank you.